take care of healthcare for AP and Telangana. So today we have gathered here for Mother's Day panel discussion under the IP Times Conversation. Okay, we are delighted to host you, doctors. Okay, and I would like to welcome Samit Shekhar. Kamal would request to give a bouquet. And we welcome Dr. Kiran D. Shekhar, Kamal, to give the bouquet. We welcome Pratima Gova ma'am, doctor.
Thank you so much.
So we are delighted to host this session, and we look forward for an interesting session. Thank you. Now we'll hand it over to Deepal, our editor, response, to take it forward. Thank you very much.
Thank you. Jesse, is it recording? Yes. Fine, right? Thank you. You know, I think Mother's Day, more than any other day, connects the world in ways which probably transcend every other identity, whether it's religion or, you know, your national identity or your geographical identity, because the concerns are very close to the heart. And even as medical technology keeps advancing, there is a whole plethora of emotional questions, psychological questions, social questions, which keep revolving around this super speciality. So really there isn't anything more befitting to do on Mother's Day than to share everything that's possible. And so I'm so super thrilled to have senior people like you, people who've seen it, done it all. And Dr. Kiran Shekhar, we've heard so much about you, so looking forward to all your insights. And you know, I know that when you were the VP of Foxy, you must have picked up immense understanding of the subject with thousands of doctors and super specialists with you, under you at the time. So your revolutionary work and the insights you drew from it, we really would love to share with our readers. And Dr. Pratima Grover, we've heard that you are really obsessed with all the evidence-based protocols, and you have taken this entire process-based super speciality far ahead than it used to be. And honestly, I think women, when they approach an IVF center, they really want, it's like putting your whole life into somebody's hands. It is so big a moment. I mean, people talk a lot about the finances, but I'm just talking about the emotional side. It's so huge. So I think this obsession that you have with protocols and processes and doing everything exactly bang on right, your education at the Cleveland Clinic, I'm sure would have enhanced this entire understanding. So looking forward to all your insights on that. And Dr. Samit Shekhar, as owner and director of Kiran Infertility Center, your leadership in IVF programs, your understanding, your education and specialization in the men's health and andrology space, I think that is the other half, which often does not get discussed at all. So it's incomplete knowledge. So today we are really looking forward to a robust discussion which is complete. And after reading the story, I am sure our readers will feel confident and sure about how to take forward their own motherhood plans. So thank you. And we dive right in. We were just talking before we came up about how is IVF looked upon today as a treatment? Have you seen a shift in the way women look at it, from difficult to approach, can I tell my family I don't think I'm going to conceive naturally, to should I just go to the IVF center and speak? Ma'am, how have things changed? You've seen this over many years.
You started with a very relevant question. Actually, when I started this journey of IVF in my career about 25 years back, uh, patients, used to come with little bit of a hesitation, and some doubts in their mind about shall we go and directly ask for IVF, because they used to consider it some kind of, they used to think that either you take the gamete donation or something like that, and the whole, society would think that they went for IVF means something must have
Something
been
wrong.
with the
You feel like you're flawed somehow.
yeah,
Your
some
body is
kind of,
not up.
some flaw was there either in husband, which was not told to the in-laws and to the wife's family, or wife had some problem and it was not told. So they used to sometimes come and say in private also, madam, I will send another patient, but don't tell this patient that I underwent an IVF with you. Just say I conceived by a natural method. So from there I have seen a very big shift. Now actually they come directly ask you, we have gone through all these procedures, we have had this much failures, we have had IVFs in other centers, we have had failures, and this is all our investigations, our history.
Yes.
And even the husbands are ready to admit that my count was low, or it was the sperms did not have motility. So every kind of report they are ready to discuss with us. So as you put that question, now I have seen a lot of change, but still some patients, are little hesitant and all, but I think it is mostly taken care of.
That's just so good to hear, ma'am. That's so good to hear. So the other half of this thing, the whole social norm, was that forever we had women who were looked upon as, is she capable of having a child or not? Like as if it was only the woman. So I really have to ask Dr. Samit, why is it that the men in India don't even think that it is possible that they could be the other half of the issue?
At the onset, I would like to thank the Times of India and you personally, the editor, and Reshma and the team for having us here and having this discussion on a very relevant topic of our times. Coming to your question, ma'am, what we discussed earlier informally, that men always equate, or some of the men at least, tend to equate virility or their performance in the bedroom with fertility, which are two totally different things. So when you look at science and the numbers, 50% of all infertility cases are attributable to the man and 50% are attributable to the female. So that's a big incidence, and I think the awareness about this is increasing as people get more educated. But programs like these will also help, initiating that discussion within the fraternity of men, that they could also be one of the reasons for not having a child.
So is it that in your counseling you insist that the husband must come along with the woman so that they can...
Yeah, I'll take this one. Yes, we usually prefer both the couple to come together, when there is a counseling session. Usually the woman comes in first and gets her investigations done, but we definitely want the husband to be together because the counseling is for both of them. And investigations also, the male partner has to come in. It's always better when both of them get investigated together and counsel together because, there is where you completely show them the correct picture. It's about counseling about what's going wrong where. Why have they not been conceiving for so many years, and what is the diagnosis of, the infertility right there. And then how do we carry on this, ahead. So all these things, if both of them are there, indeed, with the husband, there are in-laws also coming in now.
Yeah.
Sometimes the in-laws also join in. But then husband, yes, it's a must that they should come. And nowadays men are, coming in with the lady and they don't...
more open mind.
Yes, I think that's something which women are asserting on men nowadays.
Nowadays.
That
I'm
if
not
you don't come, then
It's not going to happen.
Yeah, so that thing is, assertiveness is very important, and that's happening in the society now. Now women feel that okay, it's just not me, it's you too. So you have to come in, and instead, sometimes they say, "Pehle inka karao," get his investigations done
Yeah.
because I've had enough.
Yeah.
I've had enough.
Right.
So.
Yes.
So that's how they come in assert, and then they realize that if this has to work, obviously the marriage has to work, then he has to realize that,
Yes.
this is very important.
Absolutely. No, ma'am, I know so many couples who have tried so many things in their lives over the years. And they're from the best families. So, this whole lifestyle question that comes. Okay, there is something in modern lifestyle that is becoming a bit of a disturber in this whole flow of natural life. Believe me, I've known people who take great care of their diet, they exercise, they are peaceful people, spiritually minded, you name it, and they haven't been able to conceive for decades. So I think this, for a woman or for a couple, let's say, who is not able to conceive, this whole question, and it's very often, no, we keep saying, "Nee, lifestyle," as we say it is, with this kind of lifestyle, you will not conceive. So, is this a lightly thrown critique, or is this genuinely the reason why most people cannot conceive? I mean, the number is pretty high, infertility number is pretty high. I just had the reports. So, I'm talking about having considered conversations about infertility and not loosely talking about it's just the lifestyle, or whatever. So, what is the best way to talk about these things in society, since this has become such a common problem?
As you very rightly put it, talking about the lifestyle changes, how the way you behave every day, the way you sleep, what is your diet, what is your exercise schedule, all these we will ask. Definitely, it has a very big bearing. But most important things are, like the other investigations which we do to find out what is for a female, her uterus, on the ultrasound, her ovaries, her fallopian tubes, and her other peritoneal environment and the things inside her, inside the peritoneal cavity and the pelvic cavity. So these are what are called as the organic faults in a female. Supposing her fallopian tubes were only blocked because of some infection in childhood, which in India used to be a common infection like tuberculosis, or some other kind of infections, were very common when I was a student of MD and doing my postgraduate studies. Anybody used to come with infertility, most of them were having blocked tubes due to tuberculosis. Because these lifestyle changes, as we are talking about, hadn't come in at that time. I'm talking about 40 years back or 35 years back. So organic causes were more at that time, like fallopian tube blockage, or some kind of abnormality in the uterus, like she had a septum in the uterus, or she had something wrong with the cervix was blocked, and the sperm didn't enter at all. So those are the organic causes, and now attributory causes, or causes attributing to infertility. So there I would discuss, what you call the regularity of the relationship between husband and wife.
Yes.
That is also very important. The first question we ask is that only. So nobody shies away from that question. Even the patient doesn't shy away. She says, yes, it is like this or it is like that. So that has an important bearing, like at the time of ovulation, or sometimes long distance marriages. Husband is somewhere away and the wife is staying. So that kind we have lots in Hyderabad.
Yeah.
So that also has a bearing. So like what I would say is, as you said, loosely putting everything around the thing that because you are not doing yoga, because you are not doing meditation, because you are not eating all these organic foods.
Yes.
It has affected the ovum quality, the sperm quality. Definitely it has affected. But organic causes are also in the husband, in the wife. Which I think we will be elucidating later, like what are the causes. So, but as you said, that some people look very quiet under this thing. They are leading a good lifestyle, and still they are infertile.
Yes.
That is a possibility.
That is a possibility.
I'll add a point here if you can give me this thing. Well, now the question you asked was lifestyle, does it really play a role? So back times when she was, in her younger age of practicing IVF, and now 40 years when I am practicing IVF, I do feel that lifestyle has come into, plays a major role, because now I think the concept of living, a healthy lifestyle somewhere has changed. Initially, there was not so much of, addictions that men and women were, into. See, the most important being alcohol or, smoking.
Yes.
Down around, say, 20, 30 years back, we never had it was not a social event where women used to go and, sit in the pubs or, or have, kind of a drink every evening or every alternate evening. That lifestyle has definitely come in, and we should really accept that fact. Even about, addictions like smoking, all these things also impact your fertility. And that's actually, with this kind of, lifestyle that the women and men are living now in the modern times, it definitely, if you go around the IT area,
Yes,
if you see the number of, now just, you know,
The
the
pubs
largest pub has opened up in Hyderabad, it's shortly opening up.
Yes.
So where you will all find all these young people going in there, and those are the people who are in the fertility age group, you know. And then definitely I would suggest, I mean, probably 40 years back, yes, this issue wasn't an issue which would, you know, really be a state of concern, but now definitely it is a concern state wherein, you know, the female especially and the male, both of them with these kind of addictions definitely would have, you know, hamper their fertility.
So an early education on infertility and fertility is a good idea then, right?
Yes.
I mean,
Yes, I think it should be started in some schools as per the government syllabus. I think sex education is offered. I think basics of fertility in the male as well as the female, I think it can be looked into. But having said that, stretching a bit more on the lifestyle aspect,
sure.
you know, when we see individual patients, you know, we see, for example, in male infertility, I would see a patient who's say 120 kilos and smokes and drinks, and his sperm count would be perfectly fine. And then you have a man who's an athlete, or, you know, not having any kind of
That's what
vices,
I'm saying, yes.
and he could be having zero sperm count, which is a genetic issue. So, you know, each patient has individual issues, and it has to be looked individually as well, rather than just broadside it and say that, okay, infertility is rising because of lifestyle reasons only. That's not the only reason. There are a lot of other reasons as well. Yes.
But lifestyle is becoming a major contributor.
Yes, you could
Yes.
Definitely, because that's in your hands to change.
Yeah, that is the big
Yeah,
thing.
that point I would agree. Like, it's
You can actually change with your will, you know, your lifestyle. That's a very good point. So, so fundamentally, just extending that education bit a bit, what kind of care would increase fertility in both men and women? And then I have a few more questions connecting to that. So, would you like to take the Dr. Kiran?
What kind of care, you know, would improve the fertility is like.
Is there something we can do additionally?
Yeah, young girls having. We were when I was in Foxy, you know, active and all, we conducted a lot of adolescent age group workshops.
Okay.
Like earlier, that concept was taken as something. Why are you teaching the girls sexual education? Why are you teaching the boys, making them sit together and showing them the external genitalia, everything? And why are you doing? Because they thought this would lead to. That was, I think, the concept about 25 years back
Yes.
or something in Indian schools and all. But that was totally changed when we conducted workshops in schools. All the Foxys branches took up that work and all. So they used to go show the anatomy and all, and they used to say, if you are sexually active, like even that we have to tell them, isn't it? That if you are sexually active in that age group of 16, 17 or 18, then take all these precautions. You know, these are the precautions you have to take for the boys also, for the girls also. And don't shy away if you had any complaint like while discharge or period or you had anything in the male, in the boys also and girls, please go to the doctor, and nobody is going to judge you. Nobody is going to, you know, pass a comment on you or not. If you are not comfortable with your parents, come down to a gynecologist and we will help. So that kind of education in girls will go a long way.
Absolutely.
So like reproductive health would be improved. So if she doesn't get any chlamydial infection, chlamydia is, you know, an organism which is past sexually transmitted disease. And other kinds of course, those venereal diseases have come down, like gonorrhea, syphilis, all that we used to have come down in incidence with the modern times. But still, chlamydia is a very big, like a culprit which causes silent closure of the tubes and all.
Yes.
The girl won't know also. She'll just have some pelvic pain. She will think it's my menses or something. And finally, when she gets married and all, it will be closed. So sexual hygiene, even if you are not sexually active, maintaining a good menstrual hygiene.
Yes.
So those workshops also we did. Menstrual hygiene, and you know, like some girls were not able to afford the, you know, like measures for the sexual hygiene, like pads and all that.
Sanitary pads.
They were provided with that. Of course, that awareness has come through movies and everything now. So that is not, people, you know, their economic background has also increased,
Yes.
you know, improved. So they are able to afford, those girls are able to afford that. So if supposing you take care of your sexual health, your menstrual hygiene, and you be little careful about what you do before marriage and all, and at the time of marriage, I think that is going to go a long way in preventing infertility, of course. And when you will come to the other topics, we'll discuss in detail when PCOD and all
Yes.
those things, like don't become fat,
Yeah.
don't be too thin like anorexic, eat your proper food, homemade food, like exercise. So all these things are going to go a long way in making her, like by the time she reaches even 25, 30 also, I think her fertility status will be better when compared to a girl who did not take care.
Yeah. And if you look at it in one way, it sounds like simple advice. But if that simple advice is not followed, you pay such a big price, in terms of.
More than the advice, I think the awareness is very important. So if it comes on a mass scale, then I think it makes a lot of difference, a huge impact.
Yes.
Because now the scenario is different. Like young girls getting into in the adolescent age getting into sexual activities. All these awareness is very important, and most of the girls are getting the awareness because it's again through a lot of social media and a lot of movies that have been promoting all these things.
But to
So
get the right advice.
Yes, the right advice is again through the right kind of people coming into the picture. Yeah, they shouldn't be misled.
Yes.
That is something which is very, very important. So
Maybe one or two sentences I will add is like abroad and all, when I went and saw the scenario there in UK and US and all. So without the parents' this consent or without their permission also, they were allowed to go in for OC pills.
Okay.
Yeah, so like little bit it sounded little odd for me because even though practicing for so many years, I said, what is this? You are not going to inform them. They said, no, we are not going to inform. She is about 16 years old, so high school, and we are going to give her OC pills because in the long run, if you think that is a better option rather than having an unwanted pregnancy, going in for a abortion which is not legally correct, and in some quack's hand where you get into infections and all that. So there they were allowed OC pills. I think if we go into little details, we know what age they are allowed. And US, UK and all. So I think here in India also now they are being allowed, by certain gynecologists not to go in for that and prevent other complications. So that I wanted to know.
Yeah. So that's the thing, that this subject has so many touch points around it, which are not directly only about IVF. There's just so much social and cultural environment around the subject. So I think people who in this field have to be extraordinarily sensitive, like almost like psychiatrists and people who extend a whole host of intelligences, not just about IVF. So I can see what it takes to run a center.
So that is why counseling has become a very integral and very important part of our practice. So when a patient first walks in to have a consultation with us, we spend about anywhere between 30 to 45 minutes just counseling them. We have professional counselors, psychiatrists, dietitians to address each and every aspect that might affect their treatment. So when you address lifestyle, a patient would tell me that, no, you are telling me to avoid something which is unavoidable. I do a night shift. How do I sleep properly? So what do you offer in your counseling as an alternative to that? Okay, fine, maybe you can't correct your sleep, but what can you correct? You can correct your diet. No, I can't because I eat from my office. Whatever they provide me, I will eat. No, you can take that extra effort, maybe cook your own meals,
Yes.
follow a diet, take some supplements, which will help you preserve your fertility. So avoiding screen time, avoiding laptops, avoiding mobile phones, this is not going to happen in our day and age, especially for somebody who's working in the IT industry. So, but there are certain things that you can still do as part of your lifestyle that can negate these effects to a certain extent. And that is where counseling is very important.
It's very, very well put. And I cannot, I can just think of so many examples of people who could have been helped if they just met the right counselor at the right time. And the way we check our blood, we are constantly looking at our RBC levels and just ensuring we are okay. I don't think we do it now, but I think there will be a time very soon when we will start checking fertility levels.
soon Apple will come come out with, that there are trackers. Why not? The ovulation trackers are there. They have the LH kits, nowadays available,
Yes.
where it's much easier than it was before.
Yeah.
Yeah, so a lot of people in the West do track, and even in India has come up, like, where you can track your own ovulation, with an alert search kit.
Yes.
And yeah, but not as easy as, having it on your phone.
Yes.
Okay, this
Totally.
is the time now, I'm fertile now, let's, plan. So,
Because, like, whether you do go to the WHO or anywhere, preventative medicine is the name of the game in every single
True.
super speciality now. So, it would be the case in this space also. And and it would just be made commonplace, to help people. And in this case, everybody needs that kind of help. So, what kind of evaluations are normally conducted in fertility assessments at your clinic normally?
So I will cover the female infertility
Sure.
and he can cover the male infertility.
Sure.
Female infertility, as the patient walks in only, we actually see her phenotype. Medicine we call it phenotype, means, not the appearance wise I am saying, but what is the body weight, how is there any hair on the face and all, what is the hair on the scalp, all those things in a glance we can, if you are dealing with infertility, we do all that also, because that has a bearing on the other hormonal levels and everything. So that would be her first thing, to check her weight, check her blood pressure, and when she walks in, take her detailed history. We have the pro forma, so we don't miss out on any aspect like that. So that is taken care of. And then the first and the gold standard is to do an ultrasonographic examination and a blood test. So the ultrasonographic examination, as earlier we used to say, only do it on the second day or do it on the 14th day to know the ovulation, or just before menstruation. It's not like that. Any day she walks in, we know. Supposing today is the 5th day of menses, we know what will be the picture on the 5th day. So if it's not corresponding to that, I would, form some opinion about her. So any day she comes and she is willing, that is a very good, like a third eye for the obstetrician and gynecologist. So, the ultrasound has become like what we used to do with the fingers before.
Yes.
That was called as a pelvic examination.
Yes.
That time when we joined medicine and we were postgraduates, we didn't have the ultrasound. So with the finger pelvic examination, we used to see how is the uterus, what is the size of the uterus, whether there is any fibroid, even that we used to diagnose, whether there is any ovarian cyst on either side in the ovary. So all those used to be our like how we used to feel inside.
Through the experience,
Yeah.
yes.
So that era has now been replaced. The pelvic examination has become obsolete now. Nobody does. In some situations we may do, but the moment you put a vaginal probe inside, the ultrasound probe which goes inside the vagina and very close to the uterus, everything becomes very, very clear to us. Like the uterus becomes very clear. Any fibroids are there, it becomes clear. Ovary size becomes clear. How many eggs are there also in the resting stage, we can count. So, and any factors in the pelvis, like lot of fluid inside means infection, like that. So of course those details we can keep it for later. So ultrasound examinations and blood tests. Blood tests would entail the general tests, as you were saying, like hemoglobin, this, that, everything we do. Diabetes, is a diabetic or not, and whether the cholesterol levels are high, because that also has a bearing. The lipid profile, triglycerides, and her renal functions also.
Okay.
Renal functions are very important because that also has got a connection with the reproductive system. And her endocrinological tests, that is the hormonal levels. So there are two types of hormones. One is the hormone released from the brain, which will cause ovulation. So that has to be in a cyclical manner.
Okay.
And those hormone levels have to be low initially and rise after ovulation.
Okay.
So that we know which day it will be how much. So that level is called as follicular stimulating hormone, which causes the egg to grow, and luteinizing hormone, which causes the egg to break, because the egg has to break, that
Yes.
shell has to break, and then the small oocyte has to come out, and that will be fertilized by the sperm. So that levels we do to find out if they are correct or not. And recently new tests have come to know your ovarian reserve also. Ovarian reserve means, like a girl walks in and says, I am 30 years old and I want to know how many eggs I have still inside.
Sure.
Or how many years can I go on like that without getting married. And also that level is called as anti-Mullerian hormone,
Okay.
AMH,
Okay.
in the short form. So this anti-Mullerian hormone has to be in the range of 6 or 7
Okay.
units, nanogram. But when it comes down and comes below 2 units or 1.5, then what happens is the egg reserve is totally depleted, it's gone. So we have to be careful and tell her, counsel regarding. So lots of other tests are there, like inhibin levels and other levels, testosterone levels if there is a PCOD patient. Like her male hormones rise in PCOD,
Yes.
like you know that. So like that we have to go on looking at the hormonal profile, these tests, and finally an X-ray test and ECG because she's going to be a mother. We want to know if there is anything wrong with her lungs or anything wrong with the heart. So those cursory investigations like that. So there is a type of whole battery of investigation.
Yeah, that's what I
But
get
if
to.
we want to be cost effective and others and all, we only do the ones which we really need. And some cases they have some other problem, we will do other tests.
Yeah, that's quite a lot of. I mean, I see this as a pretty in-depth, assessment of the human body, right? I mean, your hormonal state depends on a whole set of organs functioning properly, and so that's why, in a way, this super speciality kind of tags on to almost every other super speciality that exists. So, Dr. Samit, you wanted to talk about the.
Yes. So with regards to the male factor, the most basic test when a male patient would walk in would be a complete semen examination. So basically, the male would provide his semen sample by masturbation in the hospital premises, and then we would look under the microscope and assess the total sperm count. So normal sperm count, according to the WHO, is 20 million or more per ml. And you would look at the motility, meaning how fast the sperm is moving in that particular field. That is also a very important aspect, because if you have a normal sperm count, but the motility of the sperm is very less, then it does not have the capability to go and fertilize the egg of the female. And then you look at something called as morphology, or how many normal forms are there. So contrary to popular perception, about 96% of the human sperm is abnormal. Only 4% is normal.
I see. That is quite a
Yes.
number.
Yes. So
Really?
that's how nature intended it to happen.
Okay.
So basically, all these three factors which we look at, and apart from that, obviously, when this comes in as normal or abnormal, then you look at the other aspects of it. Then you take their family history.
Yes.
If they have a history of a miscarriage in the female, or an abnormality in the previous child,
Okay.
then you look at the chromosomal pattern of the male and the female both. Because sometimes their normal chromosomal makeup would be normal, but they would have something called as micro defects. This can happen. It is something called as Y chromosome micro deletion in the male, and this is special. This is diagnosed only through specialized tests, which we also offer as part of the genetic counseling of the patient.
Sure.
Then, obviously, depending on the result, there are a lot of supplements today that can help the male to increase his sperm count and motility and morphology, which is commonly known as coenzyme Q10,
Yes.
which is a
Superfood.
wonderful supplement which helps not just the sperm count in the male. A lot of women also can take it. It improves your general health. It improves your cognitive function. It improves your heart health. And you have omega-3 fatty acids, basically called as fish oil. Even these improve your sexual function as well as the fertility function.
Yeah. So clearly this requires a deep understanding of the subject. So it is always best to just go to a professional rather than imagine within yourself what is not right in my life or body. And
Yeah, so these battery of tests that we are putting the patient through helps us diagnose the problem, and we can probably counsel the patient the very next day. Now, what are the issues that you are dealing with?
Yes.
Like whether the woman is having a PCOS, or if there's a low sperm count, as Dr. Samit said. So the counseling and then the treatment.
it's like the
So
heart of the.
Yeah. So these tests should be able to help the patient, even ease the doctor.
Yes.
To
That
help them form a guideline as in what kind of treatment will be the best for you and offer you the maximum result in a short duration of time. See, that's the advantage of getting so many tests done. It's just not that it's to make the patient,
Yeah. Go
just
through
have
these
the,
tests.
feel mere itne test. I mean, I've gone through so many tests, but what is it? But if you can, with these many tests, pinpoint, okay, this is your problem and this is your solution, it gives them a lot of
Relief.
yeah,
More than
I mean,
anything
and
else.
just the very next day, all your reports are on the table, like so you really get that confidence as a doctor, and
Yes.
definitely across the table where the patient is sitting, she's also very confident. She's very, very confident. Okay, this is my problem. You've told me what my problem is.
Yes.
This is the solution. Like this is how we're going to go ahead. So I think investigations in infertility are, I mean, are a real, help to the patient as to the clinician.
Absolutely.
We should, I mean, have that approach, give them those investigations, and it should be a part of your clinical protocol. And saving on that would actually, we would miss out on certain things, and then the next cycle, So the lady misses one cycle completely.
Experimental, it becomes the
So, and if you can
treatment.
give them that hope, okay, you will start your treatment tomorrow,
Yeah.
and, if her results are good, the
Yes.
next month she's pregnant. So
Yeah.
there's something which she will be. And so many patients tell that, you just got my test done and
Yes.
now I come pregnant. So
Yeah, you're grateful actually for your whole life.
So you didn't do my treatment only, just test me, you gave me a pregnancy. And that's how she puts it across to her friends. Just go there, she'll just get your test and you might just get pregnant. But it doesn't happen all the time.
Yes, yes, yes.
So that's something which, investigations do play a role,
No, that's
Yeah. And it's simple as blood, as just simple as blood test and ultrasound, which is hardly going to be, a 15 minutes job.
yeah.
Nothing more.
One important thing I would like to address is that fertility science, like all other branches of science, has advanced tremendously in the last 10-15 years. So earlier, like 10 years back, we would only have certain tests to do, and we would have had to diagnose based on those tests.
Yes.
And that time, the incidence of what was called as unexplained infertility was very high. So we would say, okay, your reports are normal, your reports are normal. We don't know what is the reason.
Yeah.
But now there is nothing called as unexplained infertility, because if you take advantage of the science at your disposal,
Yeah.
when I'm talking about the patients here, there are certain tests available. If you do that, then definitely we can find out there is some problem here or here. There is nothing called as unexplained infertility. And when it comes to affordability, India offers one of the most subsidized rates for fertility treatment in the entire world. You look at certain sub-Saharan countries as well, their costs for IVF are higher than India. If you look at the USA or the UK, the amount of fees charged for IVF in India, in the US and UK it would be about 10 to 15 times more for the same treatment.
Yeah.
So I think Indian patients can benefit from that. And also one thing that I would like to say is that the state and the central government is also offering at least basic treatments for fertility evaluation at the government hospitals. So I think patients should also take advantage of that.
Of that. In fact, Harish Rao, Health Minister, was here sometime, this was 3 weeks ago, for a similar conversation, and he was also talking about they are creating a whole battery of tests for women, especially to help women. And once a week in a government hospital will be dedicated only for women's issues. And a lot of the, because women even, can you believe it, they say that they even hesitate to come forward to talk about, say, I have this problem, the mother of the house, if she has 2 young kids, she's like, she forgets herself, and she's just, so in those tests, even these, some of what you were talking about.
Especially the working mother,
Yeah.
The working mother has 2 roles.
By the time, yes, she's done with her work and her kids and the home, and yes.
She herself is the last priority for her.
Yes. So these conversations are very invaluable for that. So you were talking about CoQ10. I suppose there would be many other supplements also which help. People take. But I think is it better that they talk to a specialist and then take than randomly just take?
No, there are some common supplements, which
You
are
can
not
take.
at all harmful at all. But at the same time, they may do immense good also. To us.
Okay.
So we don't shy away or we don't hesitate from writing them in the first consultation itself.
Okay.
Because folic acid, as everybody is aware,
Yes.
folic acid, they started putting it in the food also when they realized that folic acid deficiency led to central nervous system brain defects in the baby. If the mother was deficient, then US and all, they started fortifying the food with folic acid so that that they get the minimal micrograms of folic
Yes.
acid. So that was not followed in India, but I think the doctors were very on their feet, trying to give folic acid. I remember right from the beginning, and the dose is very less, 5 milligrams or even 2.5 milligrams will be enough. So folic acid before 2 months before you are trying to conceive. Folic acid, calcium supplements, magnesium. Magnesium is another a substance which is very, very important for the growth of the bones and for the baby and all that, and for the egg also. Then certain micronutrients like copper, selenium, all these things also are important. And of course CoQ10, and there is one more drug called carnitine. Carnitine also actually in PCODs it is very helpful because it improves the metabolism of the cells and the oocytes and all. So the folic acid, calcium, magnesium, all these things are very, very important. So if I'm missing out on
Vitamin
something,
E is one more supplement which is
DHA and
which is an
vitamin E.
anti-aging, it's been proven
Element,
to, yeah.
yes. To
Multivitamins we give to everyone. Multivitamins and vitamin B6. B6 is also good for breast disease and for the quality.
yeah.
So basically, a healthy, balanced diet would negate the need for any kind of supplements. I always advise that. So a diet which is rich in protein and has a good amount of carbohydrates and a good amount of fat. So fat is something that is, treated like a villain in our diet. It should not be.
Of late.
Fat is very essential for all human functions, including the reproductive function. So it is very important that you have a good amount of good fat in your diet as well.
Healthy fat, yes.
So having those things and checking your blood levels for all these once a year would negate the need for supplements. Having said that, calcium, multivitamins, folic acid, these are safe over-the-counter drugs. And if somebody is planning for a pregnancy,
It's a good-
male or female, they can start using that.
Yes, no, that's fantastic advice. And also, I think just the mental state, I think being happy helps, I'm sure, because I think there is given that it is so linked to our hormones, and just being grateful for whatever life is given and being in a state of kind of some satisfaction that I'm sure puts the body at ease. And that's, I don't know if it is easy to measure such things, but I think these things are important.
Serotonin.
Yeah.
Basically, accepting the fact that you are having a problem, whether it is the male or the female. Once you come to terms with the fact that, okay, yes, we are facing an infertility issue and we will get help. And there are specialists who can help us. That is the first step, and it will go a long way towards addressing the stress that the patient is dealing with.
Yes.
So having a stressful environment, we always tell them that, you can be as stressed as possible. It's not going to help you.
It's not good.
It is only going to worsen your situation. Because when you are stressed, all your reproductive hormones go haywire.
Yes.
So be relaxed and trust in the doctor you are taking treatment with,
Absolutely.
and hope for the best.
Oh, absolutely.
What is it, Deepalji? I will call it as vitamin H. Vitamin H.
Yes.
And vitamin G is gratitude. Every day, be grateful for having woken up in the morning, having all the facilities you have. And that kind of a thing, they said it helps more than, like taking
Just
supplements and all the
medicine.
mental state.
Yes.
And also, the interaction between the patient and the clinician, doctor. When she comes in for the first time or when she repeatedly comes in to see you, that also eases them out,
Yeah.
So, when you are at a mental state where you are happy yourself, then, and you pass on the same,
True.
vibes to the patient, then definitely they go out, with a positive state of mind. And the one word that, you will have a baby
Yes.
does wonders to them. So,
Oh, yes.
a kind of interaction where you are attaching yourself to them emotionally. As you said, it's a very big emotional, clinch. And
I
that
can't
has
think
to
of
be
a bigger
there.
emotional.
Yes. So if somebody says, okay, I'll help you out, don't worry. That little, thought there and just passing that vibe to her or him, they just go out of the room so happy, They say,
Yes.
thank you so much, madam. You've eased out us with the tension we came in.
totally.
You've just eased us out, So, and then the next time when they come to you, they are at a much more relaxed state of mind, and then,
Able to-
the happiness coefficient is definitely higher than what it was when they came to you. So I think that
Absolutely.
talk with them, to ease them out, there could be clients from a very high strata to a very
Right.
straight up, but then
Absolutely.
everybody needs that kind of a talk wherein
Reassurance.
yes you can sail through
No,
this.
at the same time, we have to be realistic.
Totally.
Also tell them that this is your problem. See,
Yeah.
your sperm count is zero. Like
Yeah.
sometimes
Yes.
you feel bad.
You just have to
convey
be
that, but
honest with them.
It's like conveying a bad news, but we have to be vocal about it.
Yes.
We have to tell, see, it's zero now. Whether I can get this sperm from the testes or not, I don't know. So even those things we have to tell them. The bad news as good news.
Yes.
And then you tell them the options, like these are the options available to you. Give them the practical hope that okay, this is the option and this is how you will conceive. A lot of them will agree to it and then
Yes.
move forward. A few of them are very kind of people who don't really want to accept this is my problem. They shy away or they move. They don't really want to be into the practical.
That's right.
Yeah, but then those little numbers will always be there in any
In any
yeah. So
space.
those people also, you can help them, but then it's up to them to take that But definitely,
Take
as a
that
clinician,
step.
you can play a big role.
But when you offer options, Dr. Grover, I think that's a very interesting thing, interesting segue. So I keep seeing new technologies come into this space. And I'm not sure how much patients understand these technologies. So when you are, I'm sure there is more than one way to help a patient when a doctor wants to help. So how do patients choose, or how do you choose that out of these 6 options, I think this one is the most suitable? And yeah.
Again, it comes down to whether it's the female who's having an issue or the male who's having the issue. So mostly women, now with the recent trends coming in, with women coming into fertility treatments a bit late, after 30, 35, mostly after 35 or even in the late 40s or early 40s. Then the focus totally goes on to the the ovarian reserve, the egg quality, as madam has just discussed. So what we try and tell them is, now the AMH levels, the first thing that we assess them through is the AMH levels. If the AMH levels are lower than a particular level that is less than 2 or less than 1.5 nanograms, as she said, then we have to be very realistic, very practical to the patient. Tell them, okay, these are the number of eggs that you are left out with. Now if you need to hasten up your fertility journey, you can't just wait. You can't even wait for a couple of months, because all these they say you lose 30 eggs per day. That's the way your eggs you're losing. So if you can just put them across that okay, this is the way your fertility is declining, then they become very proactive. Second thing is, give them the treatments which are now latest in the the infertility scenario. Like now we've come up with a lot of regenerative medicine. Now a lot of cases have been reported, and people are doing it in our center also. We've been doing cases in a lot of numbers, wherein the ovarian reserve is like the egg quality and the egg number is coming down. So we are offering these newer latest treatments wherein the stem cells are being aspirated, processed, and then we've been injecting into the ovary, okay, on a regular basis, and when again assessing their fertility status. So these are all latest treatments which we are offering to women who are actually in a state where the ovarian reserve is coming down, or probably on the report is too low. So practically this is how it is happening. And yes, obviously if it is too low and she's gone into a state where the ovaries have failed, then she has to be counseled about the option of an ovarian oocyte donation, which is wherein she takes a donor, which is she takes an oocyte donation from a younger woman where the egg is healthier, where the egg numbers are more. So that counseling also comes in, because that's something which we'll have to tell her, okay, this is the result with your own egg, this is the result with a donor egg.
Yes.
And this is the reason why your egg reserve has come down. What is the reason behind it? After trying it with these treatments also, if she doesn't have a good ovarian reserve, then the option of oocyte donation, or if she's failed multiple times
Yes.
with her own egg, then she would definitely want something more result oriented. And then she will say, madam, why don't we sometimes patients also come and tell us, okay, I've failed multiple times, what do you
Yes.
suggest? So then it's very right to tell them, okay, you please go ahead with taking an oocyte donation, which is quite streamlined now.
Yeah. No, that's very interesting. So, Dr. Kiran, when do you suggest surrogacy to anybody?
Just to tell you an anecdote, like earlier and all, whenever people used to prepare for a lecture, so this last slide used to be surrogacy. like, so everybody knew that it's not possible, like now how we talk about a uterine transplant.
Yes.
We say take somebody's uterus and put it, like that. So it is just comes in the last, small words. So that scenario has totally changed now.
Yes.
So earlier it was not streamlined, the surrogacy, people were not streamlined, the social agencies were not there. And people didn't have that much experience also of keeping them, of taking care of the surrogates, and streamlining the whole process. So now down the line, maybe another 20 years passed, and then we started saying surrogacy as the first option for whoever has this, Like if you have failed 3 times in your IVF, if your uterus is non-functional, you have a uterus but the endometrial lining is non-functional. You don't have a lining which reaches to 8 millimeters on the day when I am going to put the embryo there. So if it is 6 millimeters and repeatedly I am trying,
It's
I'm
not
wasting her money, I'm wasting her money, I'm wasting my effort, and I'm making her, all the more depressed and all. Saying that she would say I'm not capable. And slowly, as time passes, her eggs also may finish off, and then she comes to us at 40 and says, do a surrogacy with my eggs. It will not
Not
be
possible.
So earlier, rather than offering it as the last option, now we started offering it sometimes even in the first and second consultation. Not that, like it has some other bearings like the economic reasons or, some other reasons and all, because surrogacy also is a very complex process. You have to have sometimes 1 or 2 attempts also. You have to find a suitable lady.
Yes.
You have to find, you have to take care of her health during those 9 months of pregnancy. You have to ensure that she has a healthy baby. You have to ensure that the baby is chromosomally normal. So many, things I can tell you that which I need to do. And ethics wise also our whole ethical committee should agree for that, we have an ethical committee within our hospital. So all of them, they say, okay, yeah, take my opinion, take other doctors, and Samit also says, say, okay, this is the patient for surrogacy, then I think we should not
Go ahead.
we should definitely tell them, and you won't believe that so many patients themselves are coming forward. So many patients are coming forward. Either they are seeing from the media or their relatives or their friends or something, or the celebrities doing it. Everybody is coming and saying, now you put it there, we have had enough, we don't want it.
Absolutely.
So I'll just step in here and
Yes,
add a bit
please.
more. So there are certain indications which are called as absolute indications for surrogacy. Absolute indications would be a woman born with something called as an MRKH syndrome, which is a congenital disorder, chromosomal disorder. So a female would be born without a uterus in that condition. So there's no other chance than surrogacy. There's no other option for us. So when she walks in, you tell her that this is the only option for you right now. So that is an absolute indication. Another absolute indication would be a woman who's undergone a hysterectomy, where she was trying to have a baby, and during delivery or during childbirth she bled a lot, and the doctors didn't have an option but to remove the uterus to save her life. That is another absolute indication. A woman who's diagnosed with cancer of the ovaries or any other body part. A woman who's been diagnosed with, who's undergone a renal transplant, for example. She's only one functioning kidney now. She's on dialysis. She cannot carry a pregnancy. So for these cases, surrogacy is an option.
You
These
said
are
cancer of any kind.
Yes, cancer of any kind. Because, for example, if she's undergoing
So
chemotherapy.
she won't be able to.
Because when you are yourself carrying a pregnancy, whether naturally or through fertility treatment, you have to take sometimes some hormonal supplements, like progesterone, for example. This may cause a relapse of the cancer, or certain drugs might cause a relapse of the cancer. So these patients, you advise surrogacy. Then there are some non-absolute indications, like Madam just said, right? Somebody's undergone multiple failed IVF cycles, or somebody who's had multiple miscarriages, where her uterus is not supporting the pregnancy, or where they have preterm or premature delivery. In these cases also, you advise surrogacy.
Yeah. Yeah. And are there any legal bindings in all of this? Like, is there any kind of legality which parents have to?
Yes. Now there's in place what is called as a Surrogacy Regulation Act. So now this act specifically specifies who can and who cannot do.
Okay.
For example, it has to be a married couple between the age of 21 to 50 years for the female and 21 to 55 years for the male. And what the indications which I just said, those indications, you cannot do it for lifestyle reasons. You cannot do it any longer for lifestyle reasons. You have to have some medical indication that you can do it. And then you have certain indications where, you have to take permissions from the various authorities nowadays.
Yeah?
Yeah,
there's a
so the patient
national
has to go to the district medical board, submit their documents, take a supporting letter from us, get those permissions, and then they have to provide insurance for the surrogate mother
Yeah.
and to take care of any kind of complications during pregnancy. And then a magistrate is going to give a birth order stating that the baby born through surrogacy is going to be the child of the parents and not of the surrogate mother. So there's a whole list of indications that you have to follow.
Indicators.
So it is no more a commercial surrogacy.
It's going to be altruistic.
Altruistic means the lady has to be some relative of the lady.
No, not a relative. It doesn't have altruistic means there should not be any commercial
Connect.
monitoring.
Yes.
It doesn't have to
Yes.
be
Not
related.
commercial but altruistic. And
She doesn't have to be related. She can be a known person. Yeah.
Okay.
Any willing lady,
Yeah,
she can be a surrogate.
Got it. But not commercial. It cannot be a business.
And then it's only allowed for Indian citizens again. You know,
if you are an Indian
you cannot have foreign passport, holders or foreigners coming in, which was legal a few years back.
Some time
Now,
back.
Yeah,
Now it is
now
not.
that's a big, regulation passed by the Indian government.
Shift, a big shift.
And for the single women and for widows
Yeah.
and for divorcees, ladies, who are, they are also allowed.
For a lady who's a widow
And divorce.
or a divorcee between the ages of 35 to 45 years of age, they can only do a child through surrogacy. A single lady who's unmarried, she
Cannot.
cannot do. Neither can gay or living in couples, they cannot do it either. They
So very clearly this whole lifestyle factor is out. Like there was a time when it became a trend, even in Bollywood. Let's have children and through surrogates.
Yeah. So,
But-
basically, 99% of the cases that were done were always for medical issues.
Yeah.
These cases get highlighted because, obviously the media picks it up because it's a nice story. For example, somebody personality in Bollywood or a sports
Yes.
personality doing it. It is news.
Yes.
But the majority of the cases were always for medical reasons.
Yes. That's a very important point you made, that it also depends on how the media is reflecting these stories. Absolutely, yeah. So I mean, there would be, I suppose, just one small question attached to this there would be single women and men who want to have children, just like they want to have children, they don't want to get married. So why do such people come to you?
Single woman, I think single women can go in for IVF and
Yes.
IUI through donor insemination and donor IVF. Surrogacy is what he's talking about.
Yeah,
is not
that's
that.
different. That's different.
Yeah.
So, but I'm just asking as an extension. Given
For single women, yes, it's Mother's Day, so single women can. Single man can't. So, in our country, I think this matter is now being heard by the Supreme Court as well, in relation to the LGBT community and their rights in terms of adoption and having a baby through fertility treatments, even surrogacy. So, a single male can't in India. So, a lot of men who can afford it are going abroad and doing it. For example, the US or certain countries in Europe where they are allowed. But single women, they can have a baby through surrogacy, through IVF in India.
I feel it's very unfair, you are allowing a
woman
do
too.
that, why not men? Because
Yes.
recently I saw somebody, from the IT department writing like that, that I am a 38, 40 years old man and I recently got divorced and I want to do the baby with IVF technology.
Yes.
So I would take an egg donor and put it in the surrogate or whatever it is, and whatever baby is born, I am capable of taking care of that baby. Because even adoption is very difficult for them, it seems, for single men.
Yeah.
If they go for adoption also, they will be given only a male baby itself. They will not be given a female baby. Because there are again certain things like
Sure.
social problems there. So he said that I cannot I cannot adopt a baby, I cannot go for surrogacy, and what should I do?
Yeah. So your world is full of riddles, actually. The way I see it, There is a lot of there are a lot of pros and cons to everything. So there's a lot of talk of stem cell therapy, PRP, the platelet-rich plasma. Does it cure infertility?
Yeah, the magical word for the last 3-4 years has been the stem cells. Stem cells are actually the mother cells because all of us came from two cells, one sperm and one egg.
Yes.
And then when we were implanted in our mother's uterus, when we entered inside the cavity and we formed an embryo, we were about 160 cells or 180 cells, And we had all the three layers which formed the ectoderm. Ectoderm means our skin, Endoderm means our skeletal system, and mesoderm and all is our organs and uterus and everything. So we all basically came from three layers. But these totipotential cells, totipotential means it's a mother cell, it can form any kind, it can differentiate into any pathway, we direct it to.
Yes.
Like we want it to become a oocyte or oogonia.
Okay.
So we can direct it towards that side, So these stem cells, fortunately, are found in our own blood. If we take our own blood, 20-30 cc, and then centrifuge it at a particular revolutions, we get 2-3 times we centrifuge, we get plasma, platelet-rich plasma.
Yes.
That is, not the RBC, not the WBC, but plasma which is rich in platelets. Platelets means, like we all know that they are the ones which help in the thrombus formation and clotting of the blood, and also these platelet factors can be, isolated and they can be injected into any organ, like for the brain surgeons and all, for the brain, for the orthopedic surgeons in the bone, in the cartilages and all that, and for us, like regenerative medicine for the ovarian rejuvenation. How it started was, this PRP, ladies who are undergoing menopause. She said, I am 40-45 years old, and now I am actually losing all, those female qualities. So why not I rejuvenate my ovary and produce estrogen? So
Sure.
when they injected these cells into her ovary, by a very small process, not a big process, and then what happened is that she started again making hormones and eggs and also. Again all those things came back, the little bit youth came back again for another 5-10 years. So then they got the idea, why not we do it for regeneration of the eggs? Because what we were taught is how many eggs you bring from your mother's womb. See, a girl has eggs, 6 million eggs. When she is a 3 months old fetus in her mother's womb. 6 million nature has given, And then they undergo what is called as, like self-death.
Got it.
Autophagy, that is called as. So that cell death happened, and when we were born as girls, we had 1 million eggs. And when you reached menarche at the age of puberty at 12 years, we had less eggs, only 3 lakh eggs.
Okay.
And as she was telling you, every day you are losing 30 eggs. So you can calculate it.
That is some line, huh? Really.
And
To a lady, I think she'll be more.
Totally.
Every day she'll realize, okay, I lost my
Another
30 eggs, let
30.
me go and meet the clinician.
so like that, if you go on losing, then 300 cycles you have of ovulation.
Okay.
See, like you ovulate 14-15 years and you finish by 40 years, means how much is the lifespan, that many years. You ovulate every month, 12 times in a year. So 300, like cycles only. Imagine 6 million and 300. And all are finished by 40-42 years. So they thought that now what could we do? We could not do anything. But when this panacea came into their hands, this kind of treatment, they realized that if you inject this mother cell into the ovary, this mother cell will go and it will, what the dormant eggs are there and they had died down,
Yes.
it can give a new life to them and it can
Really?
make them, grow.
Wow.
It can make the granulosa cells around the egg grow, estrogens will be produced, and because of those estrogens and all, the egg which was, like almost dead there or had no function to ovulate, it will start forming.
Wow.
So now that is the whole, like concept behind this PRP. You inject it once or twice. You can take the bone marrow also. Bone marrow is also very rich. Fat, your peripheral fat in the abdomen, if you take 20 ml of that fat and you process it, that also is very rich in stem cells. Of course, the pancreas, the liver, all these also has got stem cells, but we can't take from them.
Yeah.
So these are our sources: peripheral blood, bone marrow, fat cells, and they can be used in any organ of your body, but for our purpose, for the ovary. So, and the patient who was told that you cannot have a baby, your AMH level is 0.00 something like that. The AMH level increased by 87%, and these studies are a little, like new only.
Yeah.
From 2012 only they started. 2014 only they started. 16 I think. Then they had the first baby. The first baby was born in Canada to an Indian parents. and that baby's name is or something, no? Zen something like, that boy
Okay.
is around now 2 years old, 3 years old. So first baby was born in Canada to Indian parents, and of course the treatment was done there. So a new tool was there in everybody's hands. So we started using it also, and then we have had also some pregnancies with that. So I think
So
that is
it's-
the
it's-
PRP you were asking about.
Yeah, so this is a growing field then.
This is a growing field, yeah.
This is something which we will have to look out for as time
Yeah.
goes. Yeah, and yeah.
There's a lot of research that is going on with relation to stem cells at both the government level as well as private research. So it's still at a nascent stage, but I think in the next 5 to 10 years we will see rapid strides in this field, which is called as regenerative medicine.
Yeah. No, I mean, it just sounds like, and it's a natural thing because you're using your own stem cells, right?
Absolutely.
So you
we
are.
use stem cells from the umbilical cord also of other people.
Ah, okay.
Other baby, fetus
Yes.
has an umbilical cord.
Yes.
Which connects from the umbilicus
To the mother,
placenta,
yes.
So nowadays we are preserving that cord.
Yes.
And fetal cells, are not very immunogenic.
Okay.
Means if you take somebody's kidney, you may have a rejection.
Yeah, but not fetal cells.
But not the fetal cell, So that also they're desiccating those cells and keeping it as a store. And if you ask them, yes, actually,
Yes.
those
Wow.
cells are also.
I think it's also become a trend in some countries to preserve because you may use it for other purposes down the road.
To treat certain diseases.
Yes. Yes. Yeah. So that's what I'm saying. The technology in your space is just growing, and it can be bewildering at times. The possibilities. I'm not even going into genetics and designer babies and all that because I'm sure that's a huge topic in itself. But I'm sure mothers come to you and say, since anyway now I am doing an IVF, is it possible? Can my baby have blue eyes or whatever? I'm sure you have some mothers who ask you such questions. So.
So
Not, we can say that.
So basically, that is what is called as a very advanced technology, and it is not available in India. It is called as CRISPR or gene editing.
Yes.
So we don't do that in India. In certain countries like Korea and USA, maybe they are doing, but here patients just want, if they are using a donor, they want, the baby to look as much as possible like them for social reasons. But really, those things are still in the science fiction realm.
Really?
Coming to intelligence, make my baby super intelligent, and like a rock star, that doesn't happen in practicality.
There is this sperm bank in, I think it is in the US, and they have sperms of all the Nobel laureates, and really, and the whole thing is they tell all these people with a certain intelligence level and achievement level that you are helping the world by donating your sperm because genetically, possibly, I don't know, maybe those children will be born with a very high IQ. I don't know, it's something on those lines. Yeah, it's there. So I'm saying the stories coming out of this space capture the world. They capture the world's heart and mind both, because everybody wants to have a child and everybody wants to be a parent at some point in life. Actually, would we divert a little bit into pregnancy, trimesters, care, what advice you give for what kind of delivery, cesarean or normal? Do you go into those areas, and do you give advice to all your patients on how to then, now that they've conceived, then how do you carry yourself from there?
Yeah, the moment the beta HCG levels, the pregnancy test levels come positive, the journey starts. I mean, that's the time when you declare you're pregnant, and then the emotions and
Celebration.
the celebration starts. So now then after that comes the day 21 of your transfer, which is where the embryo was put in. I'm talking about the journey at our place. I mean, because you asked us how do we counsel our patient. So day 21 is where the lady asks you, when can I see my baby?
Yes.
So we say you wait for 21 days, another 11 days post your test to see it on the scan. And then the 21st day is the day when we actually see it on the scan. It's placed in the uterus. It's a single sac or a twin sac, So all those, details are given on that particular day. And then a weekly scan. a weekly scan to monitor, how the baby is growing. How is the baby's, cardiac activity, has it come on time? If they are twins, if they are separate twins, or, it's a monochorionic or a dichorionic or a diamniotic. So those things are, diagnosed on a scan. And then, probably counseling about taking the prenatals, the natal, the medication, which, the supplements, the progesterone support, so all these are very, very crucial for the first trimester, that is up to the 12th week. And then probably, if she has any issues in the first trimester, if she could, have little bleeding, then they really panic, they really get affected. Okay, I've lost my baby, that kind of that kind of fear they develop. But then again, an ultrasound does help there, because you just, tell them, okay, everything is fine, your babies are fine, look at there, the heartbeats are fine. It's just that your baby is getting implanted and you have a bleed. Yeah, they might even end up in, kind of, an abortion. Some 10% of the patients
Sometimes
do
they
undergo
do,
an
I'm sure.
abortion. Yeah, then that is also very important when you counsel them. And even clinically, you are able to tell them, okay, this is a kind of abortion that you had, whether you had no heartbeat, or probably the heartbeat had come and then you aborted. So some kind of a chromosomal anomaly could have been associated with your baby. So all these things give them a kind of, reassurance that next time it should not happen, and when you treat them for the next cycle or next pregnancy, all these things are taken care of.
So the IVF center literally handholds the mother through the 9 months, literally then.
We don't handhold for 9 months.
But
Usually,
initially,
12 weeks.
12 weeks.
12 to 14 weeks.
Then you think the baby is safe.
Yeah, baby is safe. Like whatever abortions occur, if you see the pregnancy loss divided trimester wise, so 80 to 90% of the losses occur in the first trimester, first 12 weeks of pregnancy. Because usually, the nature also doesn't want a faulty gamete to implant and faulty baby to grow.
Absolutely.
So that is the nature's way only of getting rid of whichever is not chromosomally competent baby. Supposing some defect is there or not, nature takes care. So that way, if we explain them and do the counseling, they are also happy that this baby was not good. So we did everything. See, other patients also we did the same thing. It's going on, but for you it is so. It is the one-time phenomenon only. Next time it may not happen, because sometimes wrong type of sperm, as he was telling you, those can combine and you may have this. So and second trimester again some. But once you cross the second trimester and you reach your 24 weeks of pregnancy, from there onwards you go up to 28 weeks. 28 weeks is the period of viability, where the baby can survive outside on its own. That definition of viability also has come down by few weeks now. When the neonatal cares have increased, we have very good neonatal units. The pediatricians are very apt. The machines are very good. So 26 weeks baby also, 24 weeks baby also, some people are able to see that baby grows and becomes a normal adult like that. So that kind of a fear has gone away from our hearts, that something will happen if it is born prematurely. So most of the time, as what I was answering question is, later on, what losses occur in the final trimester, those are due to certain medical conditions. Like, if the mother has a hypertension, the blood pressure becomes worse, she may start going into labor. She has diabetes, that becomes worse. Or she has some cord round her neck, something the baby may sometimes, very rarely, of course, that cause is very rare. But sometimes, these are the only causes, like hypertension, diabetes, like heart disease. Those are all can sometimes lead to an autoimmune also, like, some immunological factors like that. They may have a early delivery, but we need not fear that much like in olden days, because we are able to take that baby forward and it will live.
Yes.
And twins also. Twins is a very common cause of premature labor in our kind of pregnancies, in the sense because twins incidence is about 20%, 20 to 24% in IVF pregnancies, because we are allowed to put 2 embryos. So when we put 2 embryos, both of them may grow. So that is the thing.
Yeah. No, interesting. Of course, the very famous Ambani twins are there. And the daughter, I think she had a
She also had a twin baby.
Through IVF.
Isha.
Yeah.
That's through IVF, I guess.
Yes. It was through IVF. No, it was reported.
It was IVF, right? Isha, even Nita Ambani had through IVF. She had no babies.
And she had, at least that's what I read.
Or through surrogacy, we don't know. back there in UK.
Yes, actually, I remember when the first news broke out 25 years ago about Neeta Ambani and just the Ambani daughter-in-laws. I think the first question that came to a lot of minds was, would it be the same child? I mean, see, there is a natural pregnancy and then there is IVF. So somehow people felt that if the moment we intervene in the smallest way, that child then will not be like a normal natural child. No, I'm not joking. That was the
Even
biggest.
now the patients come and ask this question,
People have that kind of a myth.
Yeah, people do. So I think that went on for a while.
Still, they have that. Will our baby be normal?
Yeah, like.
What you're telling is how they put it in Hindi. मेरा बच्चा क्या normal बच्चे के जैसा रहता है.
Yeah.
Yeah, but is it different from a normal child?
Yes.
I said it's the same child only. You would have conceived inside you. We are doing it in vitro for you, like outside. So the baby is the same baby only. And as he said that we are not allowed to, like ethical issues, we are not allowed to insert any other
gene.
Indian law also,
Yes.
FDA law also, everything. Like you cannot even take one cytoplasm and inject inside, anything. So that baby is their baby only. It's not a...
Yes.
Of course, there are treatment options like sperm donation and egg donation. So in those kind of cases, obviously where there's a married couple and if they use an egg donor and the sperm from the husband, then obviously the genes will be 50% from the male and the wife would not have any genes transmitted to the baby because those genes would come from the egg donor.
Yes.
But still she carries the pregnancy.
So she carries the
Same applies for the sperm donor as well.
Yeah. True. No, I think I'm not joking. My grandmother, I would tell her, we would have these. So 2 generations, like many families, my family was in a village and very well to do, but in a village. And you look at everybody's family tree, 6 children, 8 children. And a lot of them, I used to ask my grandmother, and my great-grandmother, she was there for a few days. I could have these kind of conversations and we would ask them, what stress to have 8 children and all that. And they would say, we didn't even think about it. And हम लोग सोच ही नहीं रहे थे because we didn't have these 25. They ask us, these daughter-in-laws today, they're going, every time they're going for a test, what is this? What are they testing? So they said, we used to look at life differently. Usme some children would die also because they didn't know, where things were going wrong. But she said it was such a...
Yeah, in the fertility history, like they would say, our 8 kids, 2 we lost. And that loss was also not they would repent and cry for years. They would say, "Dusra ho gaya." Yeah.
So everything was God's gift.
It's gift, yeah.
If it happened, it was God's gift. If it didn't happen, it was God's gift. And the whole way of looking at life was so different.
Things have changed.
So we've come a very long way from that kind of a society and culture. And all of you have really filled us with so much information and a sense of direction. What I take away the most from this very evolved conversation is that there is a whole possibility out there if you are not able to conceive naturally, which is very well thought out, very well graded, fully equipped with tests and technologies. So it is, the possibility ratio today is very high that you will find a solution. And the joy of motherhood, which is considered the greatest joy in the world, can be yours. I mean, I don't even want to talk about the social stigma and this and that, because that is whatever, it is as much as you take in your head. But if you put all that aside, just the right to parenthood.
Yes.
Like ma'am was saying when we were hanging on, it is just a right to be a parent and to have the joy of having a child, an extension of yourself possible. And while we say Mother's Day, great, this, that, there will be a whole million women who are like, I'm not able to be a mother. So there cannot be a more important conversation than this one. And I'm so grateful and so thankful, that you're here today. And you shared all your precious knowledge, which has been built over decades, and all your understanding of technology. And especially, really, Samit, thank you for putting in all the conversation about, one is the legal and the procedural aspects, but also the men. because somehow in all this conversation the men get left out, like as if you can become mother on your own just like that, you know. I mean, I don't know.
You need me.
In India, why this is a one-sided conversation, I've never understood. Even if it's a problem, it's only the woman. If it's a solution also, it's only the woman. So I think it has been a very overwhelmingly 360-degree conversation. I really thank all of you for participating in this, for coming here and sharing your knowledge. Thank you.
Thank you so
In
much.
fact, we must actually thank you, and then we are very happy and immensely grateful that you called us for, and we could make all this possible so that others who are actually in that boat, they will benefit from
They
it.
benefit from it.
When you remove, as you said, if you remove the stigma,
Yeah.
if you remove the, the thing around it which is going around in the society, definitely these ladies can come to us and, to any centers also to
Yes.
get the. Only we didn't talk about the adolescent girls and the PCOD. So
Sure,
because,
please share what you would like to.
PCOD actually is a very common condition now. It was very rare earlier, but polycystic ovarian disease, and polycystic ovarian syndrome. So polycystic ovaries now, at least 30 to 40% of the girls who come to us, for ladies who come to us for infertility, they have cystic ovaries,
Okay.
which was,
Yeah,
the
the
incidence was very low
increased.
before.
Huh.
So it has increased by 40 to 50%. Some studies are also saying 65%. And the syndrome, which most of the girls are unhappy about and come to us, they come to the infertility center only even when they are not married. They are coming for obesity, they are coming for hair on the
Yes,
face,
yes.
and then acne, and
Irregular periods.
irregular periods, and ovulation, and So those girls, actually, I would advise that they should take the treatment even before marriage. There are certain drugs and all, because they also have this diabetic-like tendency. So those kind of drugs, if you put them on one simple tablet, which is very cheap, so that tablet, if they take till they get married and all, like we were talking about lifestyle in the
Yes,
beginning of the
yes,
talk. So
yes.
if they do those changes, like do exercise, don't eat all this junk food and all, and avoid contact with the chemicals and all, which the foods are nowadays having, like
Processed foods.
processed foods and
Yes.
all that. Yeah. So that kind of things, if they avoid, then otherwise definitely they will land up in the infertility center after they are married. And some of them may conceive with simple tablets and all,
Yes.
20-30%, but 70% will come to us.
So, ma'am, that, because you were talking about adolescent girls, then that is something which requires help quite early in life,
Yeah.
right?
The PCOD, it takes origin when the first puberty,
Yeah,
the
menarche.
menarche come on.
So since then, if you are having a check on that girl,
Yes.
it's definitely going to make her,
Help.
fertility carrier easy.
Yes.
Anovulation is a very important cause. Causes, we didn't split the causes of infertility.
Huh.
30% is not having ovulation because of PCOD in younger ladies.
Okay.
Of course, older ladies not having ovulation is obvious.
of age.
Eggs are coming less and all. And other 20-30% uterine factors, other 20-30% tubal factors were very high initially.
Okay.
But now
Because of
with
the
the improved
infections.
socio-economic status, the tuberculosis thing coming down, and ovulation, endometriosis is one more condition where you have these large cysts and all, those conditions, and these are the causes for female infertility.
Yeah. Yeah. So this is clearly a very gigantic subject, and also everybody is very unique. See, unlike like say, a diabetic patient where you are clearly, you're having an issue with the management of your sugar levels. This, the issue could come from any direction.
Multifactorial.
Yes, and it is without doubt that without a very, deeply evolved doctor, a super specialist, you may actually go off on the wrong track altogether.
True.
Yeah, and create more damage to yourself. So yes, you do need a very understood treatment regime and experienced hands to make sure that you are, on the right track and doing what is right for you. Which is why I was saying that this conversation actually wouldn't end even in 6 hours. If we actually went into every aspect of this treatment. But fundamentally, like they say, the safest thing is to find the right person to take advice from. That's it. and try not to Google for answers and get even more confused. Because I find that that is that actually increases the stress and the guilt both, right? So I was so happy when ma'am talked about the whole environment, and you also spoke about, the mental state of a person undergoing treatment. And you also, Samit, said that these things, because I genuinely believe that if this is not unlike other diseases where, okay, if I have a disease, you give me treatment, I'm done. Here I'm an active participant. Here I'm an active participant in the solution. You are helping me, but I'm also participating in a very big way. So my mental condition is extremely important. My emotional condition is extremely important. My faith in my doctor
Very true.
is paramount. So these aspects also you all highlighted very well, yeah, and so made for a very meaningful conversation.
Sometimes it doesn't happen that in the first itself they are conceiving. No?
Yeah.
The rest of the centers also. No?
Yeah.
She has a long journey ahead.
Yes.
So that she has to brace herself up for that journey.
Yes.
Because every time we don't have the chocolates.
No.
Sometimes we have
Wait for the
tears flowing
chocolates.
Also, like it happened for her, why it didn't happen, huh? Or they lose the
But I have a
pregnancy.
personal question for all of you. What do you feel when after all these struggles, women finally are able to conceive? Have their
We
baby?
just waiting for the pregnancy kids. First is Dr. Samit, then she, and then
You want
the
to
kids go
see-
like that.
Yes. You want
So,
to,
Why did
And
they not
You obviously feel happy
Yes.
for the patient, and you also feel happy and
Yes.
proud of your skills as well.
yes.
But you try to be emotionally stable.
Yeah.
Why? Because you know that today you have a patient who you've helped. Tomorrow there would be another patient you might not be able to help. So it's important to be emotionally stable for both the patient as well as the doctor in this field. And after this wonderful discussion that we have, I think concluding from my side, the take-home message would be that there are specialists available, there are professionals available. So if you're suffering from infertility or any kind of male or female issues, seek help. Don't try to suppress those feelings. Don't try to suppress that anxiety. Deal with it.
Yes.
Deal with it by consulting with a professional, because you will get help.
Yes.
And ultimately, you are the people, your team, your people who are creating the awareness, a huge awareness through the newspapers, through media,
Yes.
which is equally very important, because back doors, all these things will not be noticed unless someone from this
Talks
industry
about
comes in and takes these inputs and gives it back to the society.
Yes.
So I think there you guys are playing a great role, and I'm really thankful to the
Oh,
entire team and
thank you.
everyone here. Really grateful and thankful.
Thank
Yeah,
you so
kudos
much.
to all of you,
Yeah.
because we need that support.
Definitely.
Like all the people in profession need that support.
Yes.
Like something which we are doing, if supposing you call it ethical, and this thing, people get influenced by that.
See, I think the first thing we do is when you open the door is the newspaper.
No, totally.
Yeah, so
Our
that's
values
something which
and
I mean,
beliefs and thoughts are very,
Yeah.
very influenced by
yeah.
media.
So even with the social media, I still see so many people getting newspapers at home, and the first thing that they, and especially on a Mother's Day or a Doctor's Day or Women's Day, the first thing is what
Yeah.
is it for us?
Yes, yes,
Well,
yes,
obviously
yes.
that's something which everybody is looking.
Yeah.
And when you have these kind of subject being
Yeah, talked about.
Yeah, it creates a huge
Dr.
difference.
Brewer, actually, all our studies show that the faith is and belief is more in print.
Print, definitely.
What happens is on social media, yes, it
Yeah,
is tremendous.
It's genetic, yeah.
That I would.
And and a lot of women who need that, they do keep with that and go back to it, read about it again and again. And then probably approach the doctor. Probably it might not be just you, they can approach any other fertility specialist. But somewhere there, doors have opened to approach the doctor.
Oh,
And then they
totally.
get that, confidence. Okay, this is where I am, I fit into.
Yes.
I should go ahead and take my,
Take advice,
yeah.
and I'm sure
Till
they'll help
then
me.
they will be again skeptical about, or not have that confidence to explore.
Absolutely.
Because then they relate it with people. So there is where the relation comes in, and they say, okay, I also stand here, why don't I approach? Because the moment you write, she was like this, a 42-year-old female or a 42-year-old male having this. So hundreds relate to it.
Yeah, oh, yes.
Thousands would relate to it.
Oh, yes.
Yeah, so that awareness, that impact is huge.
No, and then they come with confidence and they say, listen, I have this problem. Just
Yeah.
that much has been very, very, very difficult for a long time. for a very long time. Yeah.
Yeah.
So.
आप मेरी माँ का ट्रीटमेंट भी करे थे. One of them came and said आप मेरे नानी को treatment 1 साल का बना दे रहे मेरे को. अभी 8 years की नहीं हुई. बोले नहीं नहीं आप जब तक जल्दी शादी हो जाती थी ना. और I used to practice in old city earlier.
And then, you know, the concept of gynecologist was not just limited to fertility, you know. She used to, even a bone pain or a joint pain,
No, no,
she
everything.
would go to many gynecologist, you know. Why will I go to not? That concept is coming now.
Yeah.
They would have little pain.
नहीं, बिल्कुल. There was no such
So
thing.
even now when our patients come, they'll be like, you know, sometimes a few patients of hers who are 80s, madam, मेरे को ये दर्द है. You know, like, where is fertility and where is this दर्द related to? But still,
जब वो bond बन जाता है.
we can't send them
everything,
away.
especially with the women doctor.
You guys see them, you know, like I say, हाँ बैठो बैठो. I will
That
see
is
them.
something which, you know, is.
But faith is a very big part.
और स्पेशली when somebody has sent you कि मेरे को definitely और मेरे को होगा ना, that kind of patients we have, both of us have seen, and Samit has also seen.
Half our work is done.
Half our work is done, you know, like by her counseling. कि you know, like definitely होगा. So they also have, you know, जिसको ऐसा doubting Thomases रहते हैं, those are there, you know, like they say हाँ होगा नहीं होगा.
And those are the newer ones, you know, the IT crowd, I could say, you know, who are always.
Who want to know everything,
Yeah.
and then they always know that इसका ये side effect है.
And then they will always have the computer in their hand, so फिर वहाँ से answer ढूंढते रहते हैं ना, तो फिर.
Oh, it is
Yeah.
terrifying.
Yeah.
I
So the older generation, or you know, the generation which was, you know, 20 years back, still would come with the faith. Then when the newer, you know, couples who are, you know, recently being married, or the younger ones, also, yeah, probably now they do a lot of research before coming. It's okay because that's how, you know, you are, you know, seeing the reviews and, you know, all these things have come up.
So one last question on Mother's Day. What is your message, each one of you can just tell on the mic so that.
I finished my message already.
Mother's Day.
Mother's Day.
Very specific to Mother's Day. Yeah.
Mother, as the word indicates, you know, is actually a answer to all our problems. When we were in our womb, she looked after us. She gave us nutrition, she gave us, you know, like protection, and she brought us into this world. So, as they say कि मतलब माँ के पैरों में जन्नत है, and and the heaven lies under her feet. So it's not an exaggeration, you know, like all of us still actually now, if they are no more also our parents, we remember them. So Mother's Day, mother is, you know, actually a amalgamation of so many things. She is a wife to her husband, she is a mother to you, she is, you know, working, she is actually like, how many multiple roles can anybody play? She is the one who plays all those roles. I don't think that, you know, with due apologies, men can do that, you know, so much of multitasking which she does. And still at the end of the day, she still smiles, you know, and then if her child goes to her, she doesn't scold her, or, you know, like, so, like anything, you know, like you do for her, and in her surveys, or, you know, provide her with a good nutrition, with a good, you know, praise, or whatever you do, I think that is less for a mother. So all of us are very indebted to our mothers, and, you know, all the mothers down the line in the world, you know, I say that you are doing a great job, keep doing it, and, you know, like you will be blessed, and, you know, like all of us will be blessed in the society.
Very well said.
So, for me, I mean, mom is like the world, I would say. You know, anything you would just knock at her, you know, okay, this is something, you don't even have to think twice. Yeah, but sometimes you would, you know, get a little annoyed or pissed also, but that's fine, that's a part of your, you know. But I think with my profession and me being into gynecology, I would just say that every woman deserves to be happy. She deserves to be happy, and she should love herself. That's very, very important. Self-love, you know, somewhere down the line we just stop loving ourselves. So every woman, just not on Mother's Day, but every day should love herself. That's something which I genuinely feel. Yeah, so that's because you have so many roles to do. So, you know, the priority is you. You know, the priority is you, and that I think we learn very late in life. But somewhere down the line, our daughters, you know, should be told that, you know, from the day one, you should love yourself, no matter what. So, you know, that comes in, I think Women's Day is awesome, every day is awesome. Mother's Day is awesome, yeah, sorry, not Women's Day. Yeah.
For me, you know, the definition of mother and motherhood has always been my mother, you know. I always say that I've been so lucky that working in the same field and having her to guide me all the time. So many times my colleagues used to ask me, where did you take training? When I was studying and doing my masters. So I would always tell them that I've worked under my mother. She's my senior. So always just used to tell me that you're so lucky. So it's the same thing that being in the same field, being in the same hospital, we have to maintain that professional attitude of being a senior and a junior, but that respect and that, like I said, the definition of motherhood for me would be my own mother.
Absolutely. Oh, that is a phenomenal note
That's where we are blessed.
to end.
Yeah.
To end this.
I was his thesis guide also. So we did not go to anybody else.
Totally.
When you have your guru as your mother, what more you want? So
Absolutely.
you are blessed somewhere down the line.
And also, I'm sure she was a revolutionary person at her age when she must have started all this.
And
Yeah,
probably
very
with the
true.
hardship she faced.
Yeah.
I mean, life was different.
And now we have now, for example, the work we do in the embryology lab. That time, now there are thousands of embryologists across the country. At that point of time, there were only a handful. To balance all that and to develop.
Okay. Because now I've seen a lot of labs where the stress level is very high. Why the couples who are trying to conceive, they're already so stressed when they come in. But then they're even more stressed. I don't know if this will work, what will not work. And it's very common sense to see that this level of stress will not help.
Definitely.
Because you are doing something which nature has planned, right? So I think this is a extremely sensitive space.
Need
that you're in.
stress, inhibits you to get, it's an inhibitory factor for pregnancy. Why do they say you have to be happy to have a baby? Old people used to say, be happy, you'll conceive. Why? Because that, the stress hormone, the cortisol or the hormone which is released when you stress out is, not, it's an inhibitory hormone for your pregnancy.
अभी आप जो बोल रहे हैं ना, if you come and see in the clinic, you see their pulse इतना high रहता है. हाँ, मैं बोलती हूँ ना, sister आके बोलती है, she say, मैडम इसका pulse 100 के ऊपर आ रहा है. मैं बोली क्यों आ रहा है? आज इसका pregnancy test है. इसलिए आ रहा है. आज उसका first scan है. First scan,
So it's like an exam result,
Totally. It's like,
and if they don't click through, then
then sense of guilt
yeah.
is terrible.
हर एक के हाथ में वो माला रहता है. They will be. बहुत अच्छा है वो करते रहो. At least your mind is occupied
place.
and हाँ करते रहो, like something you do to
Anxiety levels
are very high. Then
Yes.
Like sometimes you really feel like every day you must sympathize with them. Every day you must tell them a good word, kind word, and encourage them. हाँ होगा. Never say that, because it affects them a lot.
How much?
We तो बोल के चले जाएंगे, like we'll forget about it, but they will remember it
Forever and ever.
forever and ever, and they won't sleep in the night,
हाँ.
So I say all of you go sleep well, eat well, कुछ I tell the husband, अभी embryo transfer हो गया ना मैडम, स्कूटर पे लेके जाओ क्या?
That is something we miss discussing actually. It doesn't matter because the embryo is so tiny. The gravity does not have any effect on
Invent
it.
and already stuck. मैं बोली हाँ तो स्कूटर पे लेके जाएंगे ना, twins होएगा.
So they did a study in Japan, just anecdotal that after doing the embryo transfer, they made the woman jump up and down 10 times. And then they did the scan again,
She was fine.
just to prove that it doesn't have any effect. And she conceived.
Move from
She
that place.
conceived.
सीढ़ियाँ नहीं चढ़ना ना मैडम, ऊपर है मेरा घर. मैं चढ़ना बहुत अच्छा रहता है, पेट्रो होता. Something we should tell them to.
Because then they take those reasons as the cause of failure.
Yeah.
We've climbed the stairs, we went here, that's why pregnancy didn't. So that's something which you're not giving them the correct.
Give them the yes.
Yeah. So like you didn't conceive because you were not lying down. Makes no sense. So that kind of things are not. Nothing hot. It's all there.
Yes.
So there we have to, as doctors and clinicians, give them a scientific answer. Nothing like this works. Nothing like this really affects your pregnancy. It's just that embryo, the quality of the embryo and the quality of your endometrium, the quality of your uterus lining, where the baby is going to implant, makes a difference. So if you work on that,
we used to do some workshop also. Like 10-15 patients को बिठा के आयन समेत we used to give them a talk like ये ऐसा ट्रीटमेंट रहेगा, स्ट्रेस नहीं करना है. अभी नहीं करते, पर जिन्होंने पहले करते थे, एक 10-15 पेशेंट्स को बिठाते थे.
अभी वो लोग आपसी में कर लेते हैं. One patient teaches the other patient before she comes to us. She knows everything. So that's one way, where they